Good afternoon. All right. Have you already had lunch? No. Oh my gosh. Is lunch next? All right, it's been great seeing you all. Well, it's kind of like a few times I've had to speak right before or right after Al Sharpton. And I don't know what I did to deserve that, but let me just say thank you to all of, obviously, to NYU and to all the organizers. This is just a really, especially at the policing projects, just a really great opportunity to talk about something that I'm incredibly passionate about. I'm really proud that and grateful that you invite the guy from across the river over to the New York audience. It doesn't always work that way. I am a Knicks fan, so I'm in mourning with many of you. But what we're talking about here does not exist strictly in any one state, jurisdiction, community, you name it. Mental health crisis is a reality for every single American and in every single American community, and it has only gotten worse since the pandemic. We know this. Let's just state a fact. That is a fact that we are dealing with a mental health epidemic in this country, and there are many. We could spend days talking about the causes of that and how we're addressing it more broadly. But one thing that I came to believe deeply, and it sort of was born out of watching a lot of cases. Going back 2019, governor in New Jersey, I was his counsel at the time, signed a law that mandated my office, my current office, investigate independently every incident of fatal police encounter and present each one to a grand jury. It's the only state in the country that has that law. And you watch, and I watched and have watched now as we present them, every single case. And you watch these cases, and look, many, if not most of them, come back legally justified. But the question I think we have to ask, if we're being honest with ourselves, is that the end of the inquiry? Could we have done things differently that would have prevented us from being in this situation in the first place? And then when you look more broadly at the data, and in New Jersey, again, you're going to hear a lot of New Jersey boasting today. I'm sorry, it's in the job description. I think it's also in the water. When you look at the data in New Jersey, every single use of force in our state within 24 hours is reported to my office. You can go on our website, you can see it. We put it out there. And it's been out there since 2019 or 2020, I believe. And when you look at that data, one of the things, at the same time as I'm looking at these cases back in 2020, 2021, and the data is coming online, the thing that was so clear, and you all know this, is that the majority, about 2/3 of cases where force is used in New Jersey involve somebody dealing with a mental health or behavioral health crisis. 2/3. So it just struck me as so obvious that we are not putting law enforcement in a fair position because we are asking them to do everything and be everything. And there's a lot of reasons for that. We've obviously underinvested in our mental health system in this country, and I'll touch more on that about challenge, perhaps. But we have asked law enforcement to be everything to everyone at all times. We've asked them not just to be patrol officers, but to be mental health professionals and social workers and psychologists and behavioral health counselors and addiction specialists. And that's just not reasonable to ask anybody to do all of that and expect it to succeed 100% of the time. I joke about this, but it's true. My wife's a psychologist. I'm an attorney. So these are kind of dinner table conversations for us. I don't pretend that I could do what she does for a living, and I know she does not want to do what I do for a living. And that's true for every profession. You have different experiences, you have different approaches. And so Arrive Together, that's where Arrive Together come from. I could talk about all of the ways we built it out. I could talk about all of the different formulations, the funding structures, but ultimately it was a recognition that, hey guys, we got different resources and we're not bringing them together to respond to what is a common problem. And so it started in late 2021 in Cumberland County, which is about as far from here as you can get in New Jersey, down in South Jersey, rural county for the most part, in partnership with the state police and county prosecutor in Cumberland County in my office. And the original model was something that you're probably familiar with. It was a co-response model with a couple of important, I think, tweaks, namely that the officers were in plain clothes and the cars were unmarked, but they arrived together. So, I finally have sat down. I have a 6-year-old, and we sat down and wrote out what Arrive Together stands for, because notwithstanding the fact that I've been promoting it for years, I always forget. But it stands for Alternative Responses for Reducing Incidents of Violence and Escalation. Rolls right off the tongue. But of course, Arrive Together stood for the proposition that we were going to bring different resources together to incidents of mental health or emotional distress. And the results were immediately apparent, even just from that co-response model. 2022, we quickly expanded it to the first 2 municipal departments in a much different setting in Linden and Elizabeth, New Jersey, 2 of our denser urban environments, very diverse settings. And it worked there too. And then we quickly set an ambitious goal of being operational statewide by the following year. And we went to the governor and the legislature, and I'm extremely grateful. They gave us $10 million. Sounds like a lot of money. We have about a $60-ish billion state budget. I don't even know the total amount spent on law enforcement services. We spend billions on mental health care. So 10 million of that bucket is what we're talking about here. And we were able to grow this program within a year to be operational in all 21 of our counties. And now today, where we are is that we are operational in about 2/3 of our municipalities, about 2/3 municipalities serving about 2/3 of our state's population. In all 15 of our largest municipalities, we're operational on college campuses, we're operational in transit centers, and we're continuing to grow. And what have we seen? I believe we should be transparent. We should be driven by data. I think we should identify things that are working. Well, first is, and this is critical to how we expanded, we didn't do a top-down mandate of the program. I probably could have gone to the legislature. I never like to predict how things will go if I go to the legislature, but I probably could have gone and asked for a piece of legislation that says every community has to have the co-response model that we had in Cumberland County. We notably did not do that. And there's a couple of reasons why we didn't do that. The first is, I believe if we're going to bring community into partnership with law enforcement, then we have to actually listen to the community. It's a crazy concept. And so that's what we did. Every community we expanded in, we sat down with law enforcement, we sat down with community leaders, with faith leaders, with mental health providers, and we listened. And we listened to their concerns, we listened to what they were seeing, what their needs were, and importantly, what resources were available already in those communities. The beauty of Arrive is that most of what we've done has been done with existing resources that simply were not coordinating effectively. And so from those meetings, we built programs as we expanded. And we did that in communities across the state. Again, in some of our most rural communities, in our urban centers, at the shore, in our suburbs, every single community. That's how we approached it. And we created an office, first office of its kind, called the Office of Alternative and Community Responses in my office that brought statewide coordination and assistance to helping get agreements in place and other sort of technical approaches and ensure that we can continue to grow. And then we started tracking it. And we published our data, and you can go online and in just about in real time see how, obviously, de-identified. For all the lawyers here, we do follow HIPAA. But you can see trends, and you can see the types of interactions we're having. You see the demographics of the people we're serving. You can see outcomes. And here's the nutshell. We're approaching 10,000 people helped. We've had 0 injuries. 0. We've gotten people better health care. We've essentially eliminated arrests for things that people shouldn't be arrested for. And we've built trust with communities. I don't know as I stand here. I couldn't say definitively how many of those 10,000 cases would have come out with an injury if it weren't responded to by an Arrive call. I couldn't tell you that. But I can tell you it's definitely more than zero. The statistics on all the other cases show that. Brookings, a couple years ago, did a study of a subset of several hundred Arrive calls and found all the things I just told you. So if you want somebody who's not me touting the program, you can go look at the study. But one important thing it did is it also found that it eliminated racial disparities in outcomes of these calls. So think about that. We've eliminated injuries. We've allowed law enforcement to focus on things that law enforcement wants to focus on. We brought healthcare providers in and community in to be a partner in this effort. And we've built trust and eliminated racial disparities. And so as this grew, it was clear that, and as we listened to the communities, and this is all you can see again on the data on our website, it was clear that it couldn't and shouldn't be a one-size-fits-all program. That the co-response model, which has worked quite well in a number of communities, wasn't right for other communities and wasn't right for every kind of call. And so we've now developed programs that don't have law enforcement involved at all, where you have, sometimes it's a referral, shortened time referral to a social worker who's able to respond on their own. We've had a telehealth model in Atlantic County that we've explored. We are working actively with dispatch in some of our busiest cities to identify calls that don't require law enforcement and that we can respond to strictly with a mental health response. And we're continuing to evolve the program, and it's continuing to grow in ways that I think will continue to produce better outcomes for individuals. Now, I say this because I talk to a lot of folks, and I understand this perspective, that law enforcement should have no role in a lot of these calls. But let me tell you, if 3 years ago I had sat down and said to our law enforcement partners, who, by the way, have bought into this program, I'm so proud, in ways that I don't think anybody could have imagined. They are climbing over themselves to be a part of Arrive. There is not a single police chief in New Jersey who does not want to be a part of Arrive. The bottleneck is not on the law enforcement side, and this is not a criticism of the mental health side. It's that we have underinvested in our mental health resources. We simply don't have enough, which is why I made the decision that all of our money would go to expanding the mental health side of this and not the law enforcement side in this program. And so it's worked. It's worked. The data shows it's worked. The experiences we have had with it are clear that it's worked. I've spent a lot of time looking at the stories that we see, both the quantitative story of, okay, well, originally when I was using that talking point of having no injuries, I kept sort of waiting for the other shoe to drop. Like, are we going to have cases where things go wrong? And I'm not saying, knock on wood, it ever wouldn't, but the fact that we've now hit almost 10,000, and I'm still able to say that we've eliminated injuries, and we're all seeing the trends on racial disparities, and people are getting health care, there's no dispute that it's working. And as we explore and build out new models, we're able to do things that address really significant challenges. Take barricaded subjects, which any law enforcement officer will tell you is maybe the most challenging situation anyone can face, especially if they're armed. Well, we had Arrive calls with barricaded subjects, and we consulted experts on law enforcement, on mental health providers, members of the community, our violence intervention teams that we have invested heavily in New Jersey. And we looked at what worked. And we created something called the critical incident model, which we've now deployed statewide as part of a directive. In New Jersey, I have the authority to issue directives which set the rules for all of law enforcement. But it incorporates mental health response directly into a barricaded subject response, something that's never been done, or at least not on a systematic basis. It incorporates those mental health providers to be a part of the training so that we're having mental health providers who know our law enforcement partners and they understand the communities that we're serving. They often know the people. Those of you who do this work know you very rarely meet someone for the first time when they're having an incident like that. They're usually someone who's been known to people who provide these services. And we have had cases where, again, I don't know how it would have played out otherwise, but I certainly would have been holding my breath. You have hours-long negotiations, hours, sometimes almost a full day, where people put down their weapon, walk out of the house, and voluntarily get treatment. You don't read headlines about those. I've tried, trust me. In fact, I give reporters a hard time. I say, like, you guys want to write about everything that goes wrong. How about some things that go right? And that's what is going right. And it's a recognition, again, that if we bring people the resources they need, when they need them, how they need them, that we can provide public safety, we can provide health care, we can treat our community members in a more enlightened, more respectful, more responsible, and ultimately a more effective way. And so again, I could go through because I love this work, I could go through it chapter and verse, but to me, it's just a very simple recognition of ensuring that we're responding to a mental health crisis in a more clinical approach. And the best thing, one of the most encouraging things that I've experienced, and I'll finish with this and then, are we taking questions? Yeah, so I'm probably filibustering. And you have lunch. And conveniently, they stacked the lunches. It's like, you guys know what's waiting for you. We've done a lot of debriefing with teams that are a part of this. And for those of you who do this work, I think that's really important because you don't always get it right and you want to understand how you can improve. And I've attended a number of these. And one of the most rewarding experiences I've had is listening to our law enforcement officers and our mental health providers do these sort of joint debriefings. And to a person, they start off talking about the first day that they showed up to an arrive shift. And it was like junior prom, maybe at least for me. Maybe your guys had a better junior prom than I did. But it was like, you got the mental health providers in the corner over here and the law enforcement officers in the corner, and they're in the same room and they're just talking about each other and they're not really sure how to communicate. And then like a week later, they're like picking each other up, buying each other coffee, and it just has an impact immediately. And remember, these officers in New Jersey that are participating in mental health providers are crisis intervention team trained. Every officer in New Jersey is ICAT and ABLE trained, bystander intervention and de-escalation trained. So we're the only state in the country, I still believe, to have done that. So these are the best trained officers you've got. And they all, to a person, say the best training they've had is the time they've spent on their arrive shifts. And it carries over into their non-arrive shifts. And one thing that we see in the data that I can't explain in any other way other than that we law enforcement officers, cops talk, is that in non-arrive shifts in jurisdictions that are doing arrive and in places that work very closely with jurisdictions that are participating arrive, we've also seen a decline in use of force. And to me, that is also an indication in the changing culture and what's working. And so I'm extremely proud of what we've done in New Jersey. I do think this is a national model. It is the only program I've ever participated in my time in government where the legislature has voluntarily, without me asking, given me more money because everybody knows that it works. Again, it works in every community. It works in every political environment. It's not anti-law enforcement, it's pro-law enforcement, and it's helping save lives. And now we're reaching the point where I can say it's saving lives potentially in the hundreds or thousands. And that number is growing every single day. So I thank you for hearing me out. I thank you for the work that you all do. And I love seeing conversations about this because not too long ago, this was a foreign concept. And I think 5-10 years from now, you're going to be seeing this, I hope, in every corner of this country because it's what we need. So thank you.
Thank you to the Attorney General. I know everyone's hungry, but I think if you're willing to just take one question, I really appreciate the specificity around metrics, how there's been no injuries, also specificity around the money it took to get these programs stood up. And I think for a room full of folks, myself included, who are sort of strategizing about how to, for lack of a better or less sort of trite word, how to sell this in certain jurisdictions. One angle I've spoken about and I've heard other people speak about is this actually saves money in the long term, and it saves lives. That's certainly worthwhile, and I think that should stand on its own, but it also saves money and potentially time of law enforcement officers. So I'm just curious if you either have any metrics related to that, or if that's something you could sort of speak to.
Yeah. Well, first of all, I'm happy to take more questions. So notwithstanding my lunch jokes. I do believe it saves money. By the way, the first year was 10. I went back and asked for 10 more, so we're at 20 million now. So I want to be honest about what we've gotten, which is a significant investment. But again, let's put it in context. Again, multi-billion-dollar healthcare industry, probably a multi-billion-dollar law enforcement investment in the state. Actually, definitely. $60 billion state budget, $20 million to say we're providing thousands of people better healthcare and avoiding injuries. I think that's pretty good. And you could define success of this program in any number of ways, and I've tried to give you a few different ways that I think about it. But yeah, if I'm just thinking like, brass tacks here, anytime you have a bad outcome on one of these cases, what happens? Yeah, I'm a lawyer. That I do know. So you have a bad 7-figure settlements, easily. So you save a handful of these a year, on top of all of the obvious reasons why you should want to stop these, you're also saving money. And then think about what law enforcement officers, and I've talked to a lot of them, and I've talked to the chiefs, and the initial concern, I would say one initial concern was, we're going to have to spend all this overtime to do this. It's not true. It actually, I believe, saves administrative expense for law enforcement agencies, because what was happening before, or what happens in your typical jurisdiction? Law enforcement officer picks somebody up, they bring them to the emergency room, which is not, brings them to the emergency room, which is not the best healthcare outcome. They sit there, right? Sometimes for hours. You all know this. While they're not doing police work that they would much rather be doing, and that would actually have a better impact on keeping our community safe. And at the same time, probably racking up overtime if their shift ends. That is a very common, you all know this, very common factual scenario that this program has effectively eliminated. And so, I do think it saves money. If anybody wants to do a study on that, I think it would be a very powerful tool, but there's no question in my mind there are expenses that we are not incurring because this program exists. And again, I reiterate, like the $20 million was basically to help ensure that we have a small amount for our administrative capacity, and then mostly to ensure that we have additional mental health resources. I do think, and this is not a typical thing for the chief law enforcement officer in a state to say, we have to make a bigger investment as a country in our mental health systems. And we've got to encourage people to go into this field at a time when it's a very difficult field to attract people into. We've got to address the debt that people incur to go into this field. This is as important of a public service as any other profession, and I think what we're seeing is it's core to law enforcement success. So we have to understand that, and we have to build programs that incentivize this work if we're going to really hit the scale, which I would like to see, which is 24/7, 365. Now, one thing I'll note about that, there's utility in the data because we can see when volumes of calls in are coming in different communities. And you obviously could guess when you are. You can also see the types of calls, the demographics. It's about 54, 55% male. We can see the types of responses we're doing, and you can tailor programs based on that. And as you start to get to the data sets we have, you can actually be quite effective at using your dollars in ways that have the maximum impact. If you're going to have, arrive shifts, in many places the most frequent time of call is going to be, starting early evening through early morning. And so building programs that are available during those times, that's why the data can be really helpful. But absolutely, I believe strongly it saves money. I don't think that's the only reason to do it, to let me be clear. But certainly for people who are sitting there thinking about that bottom line, which is a big reason why I note mayors, county governments, in addition to our state governments, have all embraced it. Across the entire political spectrum in our state. It's the only program I've been in that every room I talk about it in, they love it. And it's so obvious. Like as I sit here and talk about it, I think when I see people nodding, it's just an obvious thing to do. And it's an obvious success. And I hope we see a whole lot more of it.
Please join me in thanking New Jersey Attorney General Matthew Platkin.